Here we have them stretching. PNF stretching is stretching techniques commonly used in clinical environments. Passive is meaning no motion for stretching, and dynamic, they involve motion. We gotta go interview her.
Alright, let's go. Well, you can
Ask her what PNF stretching is, dynamic and passive.
Yes.
I think we're ready.
I can record it when you ask the question. Johnny, you ask the question.
What are you asking?
What is PNF?
Do you know
What is a PNF stretching?
So you want me to get one of you? Who's gonna be the model for PNF stretching?
Yes, I got the video.
What is it?
Huh?
What am I gonna have to do?
Lay on your back, on the floor, or on the table, and then it's like a two-partner hamstring stretch. There's active and there's passive, proprioceptive neuro facilitation.
No, I'll read the question and you do it.
Have you said about what PNF is?
Yes.
Have you already explained it?
Yes.
So you just need me to demonstrate.
Yes.
Right? Okay, between active and passive. Okay. I'm just making sure I don't want to go into too much if you've already said that. Okay. So basically what you need to do is somebody needs to, my suggestion is, I'm just checking my form here. Ready? Go.
Wait, no. Go like, I don't know, you figure it out. You're doing the questions. So.
What you need is to tell you what that. You guys have already videotaped yourself saying what PNF is, right? You've already explained it's a stretching technique commonly used in clinical environments. So we use this most of the time in rehab portions, okay? Or increasing flexibility. The goal is to increase your flexibility. Okay. So you already know that. So what you should pretty much do is saying we are now going to talk to Mrs. Hope on examples of PNF stretching.
Okay. Did you say that?
Well, you gotta actually record
But you're doing it.
it. Yeah.
Ready?
So we're gonna talk to you about
To continue with PNF stretching, we are now have this is Hope. Okay, so that will show some examples.
to continue with PNF stretching. We're gonna talk to Mrs. Hope.
Let's talk about PNF stretching. Most of the time in clinical rehab, where we need to use to lengthen and loosen your muscles. We're going to talk about specifically the hamstring. What do we do normally to see how flexible they are? You ask them, tighten your leg and lift your leg as high as you can. Keep lifting. Most teenagers cannot get to the hip to a 90-degree angle. That is your goal. So with PNF stretching, using a partner, we will set up under, holding this leg down, holding your hand at your knee. This is called a passive PNF stretch, or also assisted stretch. He is putting his weight on my hand. I am pushing, and he can feel. Can you feel the tightness in the hamstring? Okay? Your goal is there. You want to hold that for 10 seconds. And then relax. Now, the next time that we do this, our goal is to be able to go farther. You do not want to cause them burning or pain. You want them to feel it stretching. And by putting that. Another way is that's passive. Another way is active. Where Angel will start his stretch by himself by tightening his quad to pull up. So when he is trying to pull up, continue pulling up, and I am pushing down. Can you feel that in there? And holding it there. That is known as an active PNF stretch, where you actually are using the quadricep to help stretch the hamstring.